afternoon, good evening, depending on your location. I remain your fertility counselor, Opera Stella Thelma. How was our day? I hope all of us are doing good in our different location. I welcome you today for our live section. So I hope you are enjoying this awareness we have been creating for past few weeks now. Since last week, we have been on this section issue of fibroid growth, and today we are going to be talking about the possible treatment. There are some treatment options we have. But before I proceed, I would like to bring to our notice to tell you that fibroids are only detected by pelvic scan. Fibroid can be detected through pelvic ultrasound. So it can be detected through IMR, that is magnetic resonance imaging. It can be detected through that. So there are many treatment options we have. So the option that may work for you may not work for another person. But I know vividly, as a fertility counselor, as a histopathologist in medical laboratory, I know one effective method that works perfectly. But today I'm going to give you many options, because we are here to give you options. You can choose from the ones you want. But I believe you will choose the best and do the best, so that you will conceive. Now, in our treatment options, we have medical drugs. Yes. There are some drugs that are being sold in the market or anywhere. These drugs are mainly anti-estrogen. If you can remember, in our previous discussion, we talked about estrogen dormancy. When your estrogen is high, the tendency that the fibroid growth will be proceeding. So all these drugs are anti-estrogen, and it can help to depress the growth. But there is one disadvantage in this option. When you stop taking any drug, there are many drugs which I may not mention it here, because to avoid anyone to go there and buy the drugs without doctor's prescription, I cannot mention it here. Unless if your doctor prescribed it for you, or your fertility counselor, or a gynecologist. But there is one disadvantage in these medical drugs. When you stop taking this drug, the tendency that there will be a rapid growth. There will be the growth will double up ×3 of what it used to be whenever you stop taking these anti-estrogen drugs. So that is one disadvantage there. So we have another option which I choose as the best. And I will tell you the reason why I said is the best options. That option is fibroid surgery. When it comes to this surgery, a lot of people get said. There are a lot of mixed and legend, a lot of stories that when you do surgery, you will not give birth again. This is a fallacy. It's a benign growth. It is just there occupying space. And when you remove it, you will have space and your baby will grow. And some people keep on saying after doing the surgery, there will be a regrowth. Yes, it's not a lie, it's true. But you can help it to work for it not to grow. You can give birth to reduce what you eat. Because I'm going to mention things we need to, if you know you want your fibroid not to regrow, or to even prevent it at all, there are some things you don't need to eat as a woman. So going for this surgery is the best option. No matter who is telling you anything, no fibroid drugs No herbal medicine can dissolve fibroid. Don't allow anybody to deceive you there. Yes, you can eliminate your estrogen dormancy by reducing the estrogen in your body so that it will not grow, as in it will not really grow faster as it used to be. You can curtail your diet, but one thing is that if this fibroid have grown, there is nothing you can do to melt it or dissolve it except through surgery. No other option to remove this fibroid than going to surgery. Fibroid surgery have helped a lot of people. If you meet a good gynecologist, he will help you, not just doing the surgery, they will place you under a meal plan. That is what we do. We also do it in our office here. We place people on a meal plan. And this meal plan is more of processed food. And they are not carbohydrates, as in, there are some things we need to tell you, you need to curtail. When you curtail it, you will see that even in next 3 years, 4, 5 years, if you go to scan, you will not see anything. There are some things you need to do. That is why you need a fertility counselor to counsel you. After going for that surgery, you need to be monitored until you conceive. And I want to encourage people outside that have already gone for this surgery. It's not everything you eat. There are some things you're supposed to eat. There are some things that makes your estrogen to be high. There are some things you need to avoid entirely for the moment until after conception. I've seen some people after surgery, they keep on waiting. There are many options. You need to take a fast and a bold step concerning it. We have in vitro fertilization, we have IUI, we have ICSI. All those things can help you to fast forward it. So number 3, we have other uterine artery embolization. Mainly that one, it doesn't work in the past. Some people are making use of it in Nigeria here, but not everybody. So this embolization requires you can undergo it. And there is also another method of surgery that we have now, laparoscopy. This laparoscopy, they can do you that surgery, you will go today. But it's quite expensive. The only price you pay for going for fibroid surgery is the pains, which will last for a few months, and you will be normal and be unexpectant of your baby. So a lot of people say that it's herbal treatment for fibroid. Yes, there are some fruits, there are some leaves that can help to reduce your estrogen. That's what those things does. It cannot melt fibroid. Whoever that is telling you drink onions, drink this one, cook addian, cook ginger, drink garlic, all those things helps in reducing your estrogen level. The estrogen in your body, that's what they can do for you, but they cannot dissolve fibroid. They can only prevent the regrowth. So have it at the back of your mind. Don't allow anybody to deceive you concerning this. So there are a lot of conventional treatment methods for uterine fibroid. So, but the best option is surgery. So there are some natural ways you can prevent this fibroid, please. I encourage every woman outside there to embark on this. It is very, very important. If you're in a reproductive age, please. Number 1 is consume a lot of vegetables and fruits. Consume a lot of vegetables, a lot of them. Eat it like never before. Cucumber, cabbage, vegetables, spinach, green veggies, a lot of them. When you consume a lot of them, it will help you a lot. So consume large amounts of it. And also fiber. Do you understand me? It is an effective way to make this fibroid not to grow. And number 2 is Complete avoidance of red meat. Complete avoidance. Avoid anything red meat. Avoid it at all costs. You can go for fish. You can have many other options, but anything red meat, avoid it at all costs. Concentrate on plant-based food, such as whole grain. You know what is whole grain? Beans. You have legume, fruits. Avoid high fatty food. Any food that contains fat, avoid it. Avoid it at all costs. And also consume a lot of soya beans. Soya beans, yes, consume a lot of them. Legumes, consume a lot of them. It can help you. And another thing is regular exercise. It helps you to burn out fat, because this fat can help the estrogen to increase. When you have excess fat in your body, the estrogen will remain high. That is certain. So we also have, when you do regular exercise on daily basis, and you at your reproductive age, you are working out, you do it 30 minutes, you rest. Avoid strenuous exercise, because excess of it can hinder your can cause can affect your ovulation. Yes, it can affect your ovulation. So that is it. And another thing I want to encourage us, this castor oil is very, very nice. If you are a woman, I want to encourage you to start using it to massage your womb, even if you have not, so that immediately you enter, it will enter. Keep nominal area. So we also have regular consumption of this thing, regular consumption of green tea, apple cider. All these things help to break down this thing, break down fat in your body. And also avoid carbonated sugar. Avoid sugar at all costs. Fibroid feeds on sugar. It's advisable to avoid it at all costs. And make sure you consume a lot of anti-inflammatories like garlic, ginger. All those things can help you. We have a lot of anti-inflammatory, like this Adi and everybody is saying today, it can help to metro. It is an anti-inflammatory. Ginger is anti-inflammatory, likewise garlic, and many more of them. Make sure you take your green tea every day. Make sure you add all these things in your food. Turmeric, it helps a lot. They are all anti-inflammatory. It can help to eliminate this growth in your body. Consume fruits and vegetables, it will help you. So I believe in this section, we're able to make it clear for everybody, and a possible treatment option, and the best you need to go to get your solution. Yes. So we encourage everybody, don't allow anybody outside there to deceive you. Don't allow anybody to tell you it is possible. Other people have done it and they have succeeded. And there is one other mistake people normally make. There are specialists. When it comes to specialists, the specialists I'm talking about, after surgery, they will monitor you till you conceive. Don't just go to anyhow doctor, anyhow, he said surgeon, he said this, jack of all trades and master of none. Go to a specialist that will handle it very well, fashion your womb very well. Within 6 months after your healing of wound, you will check in. So avoid anybody telling you this one, that one. A lot of people do come out when they have reached the age of menopause. They say, okay, let me go. By that time, everything is late. If you discover it, go. Gather courage. Go and do it. And when you do it, you will see. You will carry your baby in no distance time. So try and be massaging your womb every day. So I believe this section have made a clear options and possible treatment you can choose to eliminate this growth. So thank you for watching today. Keep on watching. There are a lot of people passing through this challenge. Bring them, ask them to subscribe to this channel. We have a lot of things to dish out for you. We have a lot of things to teach you that will help you to overcome this challenge. So I really appreciate you for being part of this section. If you have any question to ask, we are here to reply you. So thank you for watching. So thank you for being part of this section today.